watching her, it was during the 80s nung sikat na sikat ang palabas na Todas sa Pilipinas, and that is why I'm so honored that I'm interviewing her today on Kababayan LA. Miss Frieda Fonda is now Dr. Frieda Brookshire. Hello and welcome to the show.
Thank you for having me, Jannelle.
And
it's so nice to be back.
Yeah, this is the first time that you're here.
Yes.
And I'm very proud of you. For those of us who did not see the first few times that you were here, okay, tell me what led to the decision of turning your back on show business to start a career in dentistry, which is so
different.
Yes.
Well, let me see. I knew I wasn't going to last in show business because not everybody can be famous for a very long time.
You could have been, though. You were very hot at that time. And you left when you were at your peak.
Actually, no, the show ended, and I didn't really know what to do at that time.
There were so many opportunities for you.
Well, I probably, maybe I don't have that drive in show business. I don't know. But I thought I wanted something more permanent, something that I have more control over, or something that would last me a long time, even if I get old and gray, you know.
Right.
So.
You never get old, though. You still look the same as how you looked when you were doing Todas.
You look great yourself, too, my dear.
Oh, thank you. Ayan, nagbulahan. But, okay, why the States? You could have gone back to the Philippines and practiced there as a dentist.
that was the original plan. I just came here to specialize. And after that, I was going to go back to the Philippines. But things changed. I got married at the time, you know, and decided to stay here.
Right. Okay, we just a quick reminder for viewers out there, if you want to talk to Dr. Frieda Brookshire, formerly Frieda Fonda of the show Todas in the Philippines, that's the number to call on the screen. And the good thing about this is because she's a dentist, she can also talk to us about dental health. Frieda, what's hot right now in your industry?
Implants.
But and we talked about this before, that's what Filipinos need.
Yes, most of them, yes.
Bakit?
Because
a diet, sugary, ganon?
No, I mean, it's changing now, but in the Philippines, you know, if you have a broken tooth, a cavity or something, okay, let's pull it.
Right, yeah, I remember,
you know? But now it's different. It's changing. More and more people are wanting to save their teeth now. So implants is a really good option for them. A hot trend now in dentistry is what we call placing the implant using computers.
Oh, how do you do that?
You do that by, you can do that visualizing it on a computer screen, and you do it with a computer. It's like what we call guided computer or guided implant placement.
And leave it to Dr. Frieda Brookshire for having like the latest in technology. I have been to her clinic. In fact, I go quite often in Tustin. Very, very nice clinic. We have some pictures that we can show you right about now. But Frieda, what do you say about or to those who Filipinos na parang titiisin nila yung toothache because mas mura sa Pilipinas?
You're putting me in a hot spot. Well, I mean, it's their choice if they want to go to the Philippines, you know, maybe because they can visit the family too and things like that. But if you have pain or infection, you know, you really don't want to wait a long time, you know.
And what a lot of people don't understand is you can't really scrimp on your smile. It's the first thing that people see.
Exactly. Not only that, I mean, I know I have a lot of patients that try to go to the Philippines, get their work done because it's cheaper. Yes, you can do that. I mean, they have the freedom to do that. The problem is when you have complications, do you go back there again?
Right.
You know?
And what are the chances of them having complications from work done in the Philippines?
It's always a risk in any surgeries, in any treatment procedures. You always have that percentage risk, depending if the surgery is complicated, it's more involved, then your risks go higher, you know?
Right. And I'm just listening to you. I marvel at like how, I mean, again, I just used to watch you dancing, body dancer, doing comedy. Can we ask you to do body dancer later?
No, too old for that.
But we'll just be asking her about dental health. If you have any problems, take advantage because this is free consultations for you, and we're going to be back to take your phone calls. Don't go away.
Kababayan LA, ahatid sa inyo ng McDonald's at ang mga bagong McCafe Espresso drinks. McDonald's na ba ang inyong bagong coffee house? Ang mga bagong McCafe Espresso drinks ay mabilis, masarap at mas mura pa. Kahit saan, kahit kailan.